Can cystic fibrosis be mild? Imagine a condition that can vary so much that some people might not even realize they have it until much later in life. That's true for cystic fibrosis, a genetic disorder that affects the lungs and digestive system. While many associate cystic fibrosis with severe health problems starting early in life, it's important to know that it can sometimes be milder or less obvious. This is called atypical or mild cystic fibrosis. In these cases, symptoms might be subtle, affecting only one part of the body or coming and going over time. Some people might not be diagnosed until they are teenagers or even adults because their symptoms are not as intense or typical. Cystic fibrosis is caused by mutations in the CFTR gene, which leads to thick, sticky mucus building up in organs like the lungs and pancreas. This mucus causes breathing problems, infections, and digestive issues. But how severe these problems become depends on the specific mutations and how much the CFTR protein still works. Some mutations cause a lot of dysfunction, leading to serious symptoms, while others result in milder effects. In mild or atypical cystic fibrosis, symptoms may be limited to just one organ. For example, someone might experience wheezing, coughing, or sinus infections, but these might not be constant or very severe. Digestive issues like constipation or mild pancreatitis might also be present but not interfere much with daily life. Some adults with mild cystic fibrosis may have repeated episodes of pancreatitis or pneumonia without developing the classic severe lung disease seen in more typical cases. Diagnostic tests like sweat chloride levels, which are used to confirm cystic fibrosis, might be only mildly elevated or borderline in these milder cases. Because of this, some people with mild cystic fibrosis are diagnosed later in life, especially if their symptoms are subtle or mistaken for other conditions. The good news is that people with milder forms of cystic fibrosis often have a longer life expectancy and better quality of life, especially when diagnosed early and treated appropriately. Advances in newborn screening help catch many cases early, but some milder forms can be missed initially and only identified when symptoms appear. Overall, cystic fibrosis is not always a severe disease. It can be mild or atypical, with symptoms that are less intense or limited to certain organs. This highlights the importance of personalized medical care, regular monitoring, and early intervention to help manage symptoms and support health. If you or someone you know has concerns about cystic fibrosis, it's always best to consult a healthcare professional for proper testing and guidance.